Okay, good morning, everybody. We just opened a little bit earlier there just to get everybody on. So if we just bear with us now for a second. Good morning, everybody. I'm really looking forward to this morning's session. So still a few more people coming in there, so just give it another second. Just 11 o'clock there, we'll give it a minute. I make that 11:01 there now. So I think we'll kick off, Dermot and Paul, if you're okay with that. You're all very welcome to this morning's webinar, reopening, ready to reopen safely again. Let's get your questions answered. With the short bit on the event overview, with non-essential retail open along with hospitality premises on the 24th of May that can serve customers outside, cafes, restaurants and bars. Finally, a sense of normality returning for businesses in Northern Ireland. So we're covering key issues, I suppose, today, really, bringing back staff and dealing with those who don't want to return, creating COVID-safe environments, workplace testing. We have some frequently asked questions on that topic, and developing a COVID-19 response plan in the event of a new case in the workplace, and finally, how to handle vaccinations in the workplace. So I'm delighted that we have Dermot Diver and Paul Logan of Peninsula. And Dermot is the Peninsula Business Development Manager from the Northwest area, and he's based in Inishowen and Kildare. And Dermot has many years of experience dealing with companies on both sides of the border with HR, employment law, and health and safety issues. So thank you so much, Dermot, for joining us this morning. And also Paul Logan, who's the Health and Safety Operations Manager with Peninsula and has been involved with health and safety consultancy since 2002. Paul is a chartered engineer since 2005, and he's worked with a variety of companies and in group health and safety manager with large agricultural and food businesses. Now, Paul's going to take us through a short presentation, but although we have a presentation this morning, there will be time to ask questions at the end, or if you prefer, please feel free to send your questions via the text box at the bottom of your screen, and we will try to get as many of them as possible. So please we do encourage you to ask as many questions as you possibly can. And as I say, at the end of Paul's presentation, we'll attempt to get through all those, and any ones that we don't get to, we'll certainly come back to you. We'll have the links directing you back to Paul and to Dermot as well, so that any questions we don't get to, we'll certainly come back and try and answer all your questions. So without further ado, I'd just like to hand over to Dermot to kick us off, if that's okay, Dermot.
No problem. Thanks, Paul. And firstly, I'd like to thank Paul and Anna at the Chamber just for the opportunity to come and speak here today, and just the work that you've put on and making it happen. So thanks for that. I suppose just for a bit of background, I know some of you are familiar with Peninsula, and maybe others may not have an idea of what we do. Peninsula is it's a family-run business, and it was set up by the Dome family in Manchester in 1983. And prior to having this business, they had another business which was a cash handling business, and unfortunately they had a member of staff who was stealing from them. So they dismissed that employee, but they didn't follow the correct procedure, and they ended up in an employment tribunal. And at that time in 1983, it ended up costing them £4,000 in legal representation and £5,000 in an award. So as you can imagine, at that time that was quite a lot of money, and were quite frustrated. So they figured that there had to be a better way for small companies to handle this type of situation. And that's where I suppose the genesis of the idea for Peninsula came from. And that's what we do today. We provide HR, employment law and health and safety support to SMEs. And we We now support 40,000 clients across the UK and Ireland. On this island, we have offices in Belfast, in Dublin and Cork, and then we've lots of locally based consultants all around the country. So I suppose over the past year, we've been quite busy supporting all our clients with, I suppose, all the challenges that the pandemic's thrown up. You know, all the employment law challenges from like employees refusing to turn to work, and then I suppose opening and closing and opening again. So today, as Paul said, I'm delighted to have Paul Logan with us, and he brings a vast experience over a number of industries. And Paul's going to run through some kind of guidance and best practice on reopening again, hopefully for the final time. And as Paul said, there'll be an opportunity to ask questions through the text box. If we'll do our best to answer as many of them as we can. If there's anything you want to discuss in more detail, also there'll be an opportunity afterwards. We'll get in touch for feedback. Maybe Anna will, or we'll get in touch for some feedback anyway. And at that point, if you want any further information, or if you want a follow-up consultation, we can sit down on a one-on-one basis with your business and have a chat over a video call or face-to-face if there's anything you want to go through in further detail. But that's it really from me. So I'll hand you over to Paul and we'll get cracking. Thank you.
Right, thanks Dermot. Yeah, let's get cracking because we've got quite a bit to cover today and things are changing again. So essentially, government guidance requires us to provide a COVID-19 secure workplace, and that still applies. We've got to look at the workplace. We've got to develop plans if we're going to try and get people back into our workplaces. And we've got to try and adhere to current social distancing compliance. We've got to make sure we've got hygiene and cleaning in place. There might be some higher risk situations, especially in close contact businesses. We also need to make sure we're considering any medically vulnerable and pregnant employees. And there still is medically vulnerable people out there who may not have been able to have been vaccinated. We also need to discuss contact tracing. And again, that's evolving as time has went on. We need to assess what's right for the business and for your workforce.
Sorry there, Paul.
Yes.
Your presentation isn't sharing there if you're intending to do that at this point.
Sorry.
That's okay.
Right. Apologies for that. How's that now?
Yeah, that's it now. Yeah.
Thanks a million.
Okay. Right. Okay. Right. Yeah. So we've got to assess what is right for your business and for your workforce. Even when employers are legally permitted to reopen their facilities or scale up their operations, you will have to do it cautiously because we still have certain obligations that we need to adhere to. And if we don't do it correctly, employers will be exposed to legal liability if there is major defects with their processes. Employees may also be hesitant to return to work. Your customers may also be hesitant to use your facilities if they've got concerns over the overall condition, or if they're concerned that they're not sufficiently safe. So let's go through some of those issues. So essentially, we've got to decide, first of all, who we're bringing back to the office, the business, the pub, restaurant, whatever it might be. And essentially, we've got to put control measures in place. The measures must be complied with, which include hand hygiene.
Seem to have a problem there. Just frozen there now, Paul has. I don't know if you can hear us, Paul.
I can hear you, Paul, yes.
No, you just froze there for a second. Your
right.
Your slide now is return to work planning and preparing. That's what's up on the screen here.
That's the one that yeah, that should be there. I'll carry on. So yeah, I'll start with the control measures. So we've got to decide who we're going to bring back to work. We have to obviously put control measures in place, and those can include looking at hand hygiene, hand sanitizing. We've got to put systems and processes in place for that. We've got to make sure that staff are fully aware of respiratory hygiene that would be required. We've got to make sure we've got physical distancing in place. And currently that is 2 meters, and there is rumors that may be reducing back to 1 meter plus in the near future. Just depends on how things progress. We've got to minimize contact where possible. We've got to consider our at-risk workers. We've also got to consider, and sometimes this is forgotten about, office visitors and contractors. People like the cleaners coming in, and in some cleaning businesses, you may have different cleaners on different days of the week, etc. So we've got to consider those things. The planning and preparation phase is absolutely critical to ensure a safe return to work. And we've got to make sure we've got the information, the guidance, the return to work forms for employees. We've got to identify who the high risk employees are. We've also got to look at maybe looking at reinduction, because in some cases, if staff have been furloughed for a period of time, we need to go back there and make sure it's still valid and relevant to them. We've got to identify and put in place control measures and basically look at our safety policies, our risk assessments, our emergency plans, and review those. Employees need to be told to self-monitor for signs and symptoms of COVID-19. We need to make sure they're fully aware of them. And we need to make sure that we complete return to work forms to assess the health of our employees before we can bring them back into the workplace. So we've got to establish and issue the pre-return to work form to employees around 5 days in advance to of return to the workplace. It should seek confirmation that the workplace, to the best of their knowledge, has no symptoms of COVID-19, and also confirm that they're not self-isolating or awaiting results of a COVID test.
Sorry, Paul, can I just interject there? Are you still on the return to work planning? Yeah, it's moving on there, but it's slow.
Yes, I've just moved on.
That's okay. No, that's fine. Yeah, no, perfect. Thanks a million.
Moved on to 7, so yeah.
Yeah.
Right. Employers should listen to what their employees have to say, their concerns. We should have a discussion with them. We may need to look at maybe flexible working, maybe offering annual leave if they're not happy about coming back. They may have other options. There may be parental leave if they've got a child. We've got to consider that, because obviously there could be issues maybe with childcare in the current situation, or any other. If that's exhausted, then we're going to have further conversations with them. If the employee is healthy and not at risk themselves, but are refusing to return to work due to taking care of someone else who's vulnerable, again, we've got to consult with them on that. We've got to talk through measures that could be taken into account and put into place. We've got to look at any additional measures that we could put in to try and reduce those concerns and have further discussions. And at all stages, we need to document these steps. If you tried all these measures and the employee doesn't give a valid reason, then we need to look at reasonable management instructions to try and get them back to work. And obviously, eventually that could lead to a disciplinary procedure, at which case you should contact us and we can help you with that. But as I say, that is last resort. We want to sort of have a reasonable conversation, because there might be lots of reasons why they're not returning to work. Say childcare is one, other members of their family who are currently vulnerable, or the fact that they may be working somewhere else, which we've found with other businesses. So yeah. Other options for people who maybe don't want to come back to work, and in some cases, some businesses don't really want all their staff back to work immediately anyway. There might be reasons for.
I think is frozen there again, Dermot, is he? Yeah.
Hi
just
guys,
went-
can you hear me?
Yes, we can hear you there. You just went out for a second
Yeah.
there. Now we're
Right,
on.
right.
What if my staff refuse to come back as the heading on the slide?
Hybrid working, yes.
Okay, yeah.
We've moved on.
Hybrid working,
you-
yeah. We can
Right,
see,
okay.
yeah, hybrid working.
Okay. Right, I'll start there again. We may need hybrid working that may not work. Well, bringing everyone back may not work for your business, so hybrid working could be considered. There may be good reasons for that. You may not have the space to bring all your employees back at once due to the social distancing requirements. Or you may have discovered that your employees work reasonably well and efficiently whilst working from home. But there is key considerations we've got to take into account with hybrid working. We've got to look at space of their home environment. They may not have the space, so they're sitting working on the end of the sofa or at the kitchen table with the kids running around. We may need to look at security, especially if we're handling confidential information. We may also need to look at the display. Well, obviously we've talked about sitting on the end of the sofa, looking at the display screen equipment requirements. It may be fine for a temporary work, but on an ongoing basis with a laptop on your knees, it's not ideal. We may need to look at electrical safety because obviously we're providing more and more electrical equipment into their homes. We may need to look at PAT testing and so on and so forth. And also there's other issues around staff welfare and mental health with people working remotely at home. They're not part of a team, and that can possibly have bearings. Other options may be maybe looking at maybe other business hubs or other centers where they can work rather than working from home, but not attend your office. So there is some facilities like that starting to pop up around the country. So the benefits of hybrid working might be environmental, less traveling. It is quite topical, trying to reduce our CO2 emissions, etc. Less cost, we don't need as much office space, and reduce risk to staff from COVID, and that builds in a bit more resiliency into the business. Disadvantages, well, lack of team working. Sometimes teams work better than individuals. They can't bounce things off each other. Oh yeah, we can use Teams, but it's just not the same as having everybody in the same room. And it's say we lose something there. Stress, people working from home may be working longer hours, or they may be doing less work. So again, that can cause stress. IT costs. Obviously, there's going to be a cost with additional equipment and duplication. And there may be other issues that we may need to consider with regard to hybrid working. And one of the questions I think we were asked recently, what about cross-border travel? Is it essential? And the main question is the work essential? And if it's essential that they go to a workplace to carry out their work, then we can argue that. So essential travel, and I think we can justify that quite easily if you have to travel to work where you cannot work from home. And in some cases, in some sort of fast-moving business environments, employees will need to travel to a workplace. People also need to travel for other reasons, and I've highlighted the key ones there that might have an impact on some of the businesses here today. Accessing education services, accessing critical services, including childcare. So you may have a childcare provider on the other side of the border, family member who looks after the children. Buying essential goods and services, people can justify that from traveling across for traveling across the border. Fulfilling legal obligations such as attending court and participating in legal proceedings. So again, that may be part of what your business does, and to provide emergency response services. So again, we can justify, but the main one is basically work where you cannot work from home, and that can be justified if it's a key component of your business, a key member of your staff who needs to obviously go to your factory, office, shop, retail, hotel, hospital, or whatever, care home, etc. So we can justify that. So what do we need to do to reopen the workplace? Well, first of all, we need to get some sort of work safety protocol or risk assessment in place. And it needs to be introduced to support employees and workers so that we can put measures in place that will prevent the spread of COVID-19 in the workplace. First of all, you should have a COVID policy, and we install those into our systems now. So that COVID policy should be there, and it should be made available to all employees who are returning to work. We should have a return to work form that we get the employee to complete between 3 and 5 days before they return to work, just to get a few details about them and their health and any other issues that may cause problems. Are they sort of vulnerable, or are they pregnant, etc.? So we need to find out a little bit more information about them. When they do return, we need to get some induction training in place. That might be around COVID training. Another way to provide your COVID training might be to maybe provide it online through e-learning before they return to the workplace. We need to make sure that we have looked at the office or the environment they're going to be working in and put some COVID social distancing controls in place, and make sure there's adequate information on how those processes and how that social distancing is to. It might require lots of signage, maybe tape, maybe floor markings, maybe one-way systems to be developed, maybe slimming down the number of people in the offices, maybe deciding which desks can be occupied, which ones not. So we need to look at social distancing, and we need to document all this and provide it to the employees. And that can be through risk assessment, through the policies, and through the training. PPE needs to be made available as well, because they're going to be going through probably copious amounts of disposable masks or reusable masks, and they need to be instructed when it needs to be used, worn, and what the acceptable rules are in the business. The COVID policy should have a few key points, and it's important we put the following in. We've got to outline an outline of the management commitment to implementing the plans and checklists, and that should be signed by usually the MD or the owner. We've got to cover what the planning and preparation is. We've got a list of control measures, some of which I've just went through. We've got to cover induction. We've also got to put rules in place around what we do if someone is a suspected case of COVID-19. We need to make sure everybody's fully aware of that, so they're not hanging around in the business, scratching their head, wondering what to do next. So we need to have clear rules on the process surrounding that. We've got to look at cleaning and disinfection, so we need to review cleaning processes and policies. And we've got to make sure we can have a way of providing that information to our workers, our employees. Some of the other things we need to provide, obviously, making sure that when we're talking about cleaning, we need to make sure we get commonly touched surfaces, door handles, light switches, kitchen appliances, toilet facilities regularly cleaned. We've got to also look at maybe providing some cleaning materials for workers in their own spaces. So it could be simply some sanitizer and blue roll or whatever provided for them to wipe down desks and maybe shared areas. And we've also got to ask them still to clean any personal items brought in from home. And we also need to update our cleaning contractors and make sure they're fully aware of what the business rules are. And we've got to make sure they're competent in what they're doing. With regard to staff training, you can contact Peninsula on how we can start to provide you with maybe some e-learning. And some of the things we need to provide in there is basically keep people up to date with the changes in the legislation and the guidance surrounding that. It changes pretty much now on a 3-weekly basis, and there's lead-ins and there's indicative guidance, and there's also, as I say, all sorts of other information that we're getting from other jurisdictions, which sometimes can cause confusion as well. So we need to make sure we've got the correct guidance for the jurisdiction. And as I say, with staff training, we've got to make sure they're fully aware of what they do if they develop COVID-19 symptoms, and that information needs to be provided to them in writing. And we've got to provide some detail in the workplace how they address COVID. Other things, we've got to also make sure that we have adequate emergency plans in place, especially first aid, because some of those issues may be a little bit more difficult to provide. We've got to maybe look at just who's trained, have we enough trained first aiders, and review that. So one thing with training, if we provide training, we've got to make sure that there's some sort of certification, because that could be incredibly useful for us in the future to prove that the training was delivered and that there's a record of that. Something new that's sort of been rolled out in increased numbers of businesses is workplace testing. And the health services, the Department of Health and Social Services are wanting our businesses to start rolling out asymptomatic testing, and they're providing free lateral flow devices for that purpose. Now, if there's two tiers for this, if your business employs more than 10 employees, you can express an interest to the Department of Health, and they will provide a protocol that you have to comply with, and they will make the LFDs available. For smaller businesses, they're still recommending that you send your employees to the local testing site, and they will possibly either carry out the tests on site, or they will provide you with LFDs for delivery to your employees or to their home addresses. There is quite a bit of paperwork around this, because there is quite a detailed protocol in what we do with the information once the employees complete the LFDs. The reason why it's important is that it's shown, especially now with the vaccines rolling out quite quickly, that people can still be infected and be asymptomatic. And obviously they're not aware that they have something wrong with them. So it's important that we do try to assist with this, because it will allow the government and test and trace people to pick up on where there might be hotspots or where there might be issues before it engulfs the system again. And really, at the end of the day, it's to try and protect the health service and not overload the hospital system. Essentially, the asymptomatic testing is an addition to and doesn't replace a range of other measures in place, such as the social distancing, the hand hygiene, face covering. So we still have to do those things. We just can't assume that if we test and we find it, that's okay. We still have to have the COVID controls that we're all fully aware of still in place. And asymptomatic LFD testing should only be used with people who are not displaying symptoms of COVID. If they are displaying symptoms of COVID-19, they should still go away and have the standard PCR test. If anybody has tested positive using an LFD, they should also go and have a confirmatory PCR test within 24 hours, because we cannot rely on the LFD being 100% accurate. I think its accuracy level is considerably less than the PCR. So essentially, a few other things on that. Following the government's announcement that individuals can access that lateral flow test themselves, we should, as I say, try and assist them with that. Right. Do we need employees to self-isolate after the flow, after they do their LFD? Not necessarily. It comes down to risk assessment. If they do their LFD in the workplace, if it comes up positive, then they should leave and go and have a PCR immediately. If not, then obviously they're safe to return to work. They should also make sure that if they are positive, that information is passed on to the test and trace at the HSE test and trace and the HSE test and trace system. Employees are legally required to inform their employees if they're officially told to self-isolate. So again, they may be, depending on what test and trace pick up, they may be told to self-isolate. Another question might be, do vaccinated employees need to continue using lateral flow tests and undergo temperature checks? And the current advice is yes, even if employees are vaccinated, they should be part of any workplace testing schemes, because, as I say, they can be asymptomatic carriers. They pretty much low risk to themselves, but they may present a risk to other employees who are not vaccinated yet. So, dealing with a suspected case of COVID-19, well, some of the things we need to put in place, we need to put further plans in place to determine what happens to the staff whenever they find out the bad news. We also need to make sure we've got plans of who may need to go into isolation. We need to put plans in place of who needs to be informed. That might be the test and trace people. And we need to keep records. The government's COVID, or the executive's COVID response plan is in place, and obviously there's a review taking place every 3 weeks. And currently we've got some new indicative measures that will probably come into place on the 24th of May. And there's obviously a review date set for the 20th, which is on Thursday. So we're currently working our way through that process. Essentially, the government's COVID business response plan essentially takes into account health trends. They look at evidence and analysis of the latest medical advice and the level of transmission and impact of the relaxations to how they may affect the future trajectory of the pandemic. They take into account community trends, which look at the capacity of the health service and so that it's not overburdened. They look at economic trends, because we've also got to consider wider health economic impacts. And they've got to identify areas where the greatest benefit and the lowest risk would result from the relaxation. So they're essentially reviewing, putting together their indicative plan, then giving most organizations about a week to make further decisions. And as I say, on the 20th of May, there will be some indicative, well, there is an indicative date of the 24th, and the sectors affected are going to be things like indoor gatherings, outdoor gatherings, travel, wedding, funerals, hospitality, entertainment, and obviously some other changes around sport and retail. So that's what we're expecting later this week. Hospitality on the 24th, they're looking at reopening tourism accommodation, and essentially it will include things which include shared facilities, so up to 6 people from no more than 2 households will be able to stay overnight. And accommodation providers will also be required to keep details of who is on their premises to help with test, trace, and protect. Indoor hospitality for table service will also hopefully open on the 24th. Again, maximum of 6 people can be seated together. Face coverings must be worn if people leave the table, etc. There'll be no live music or dancing, and overall music levels must be kept low. Again, social distancing must be maintained, and venues must carry out a full risk assessment, take all reasonable measures to prevent transmission of coronavirus. Indoor visitors, again, the 24th of May, that's going to affect, it's going to be reopening, hopefully, of museums, galleries, cinemas, indoor play areas, bowling alleys. Libraries will also be permitted to open. Certain other operations, such as theatres, concert halls, and other venues will be, they've been given an indicative date of the 21st of June. Exercising and sport, again, things are ramping up there. So the overall limit is 500 spectators at outdoor sporting events from the 24th of May. And again, from the 31st, the date has been set for the return to competitive indoor sport. So really on Thursday, we'll know if the indicative plans have been confirmed. There may be other additions to that coming along. We need to watch that space. And then on Friday, probably read the guidance and any legislation that's actually put on, or when the ink's finally put on paper. Vaccination in the workplace, how to handle it. It's going to be a hot topic. Essentially, there's all sorts of reasons why people may not want vaccinated, and there'll be all sorts of interesting discussions surrounding it. But as an employer, it's going to be a fine line to try and tread. So currently, there's no statutory provision that could require an individual to be vaccinated. Authorities are adopting a recommendation or a recommended approach, and the individuals must consent to the medical treatment. There's no plans to introduce legislation to make it mandatory. So really, it's a case of just nudge and encourage where at all possible. However, there's a number of issues to consider with regards to mandatory vaccinations. We've mentioned we can't do that, but we can't forcibly encourage them to go and get vaccinated. So obviously, it causes difficulties. So what we can do is we have to consider the legislation that does exist, and under the Health and Safety at Work Order 1978, what we can do is provide employees with instruction, training, and provide them with the information that would hopefully make sure that we're not introducing additional risk to their health or their welfare. We can only do that so far as reasonably practical. We've also got to maintain a workplace that is safe to the employee without risk to health and provision. So we've got to make sure we maintain that workplace. We've got to make sure we make it as safe as reasonably practicable. And we also have a duty of care under the order to extend that to other people who may be using the workplace, such as visitors, members of the public, contractors, other people who are not under our employ. Some of the ways we can do that, we can still encourage people to work from home where at all possible if it reduces the risk to them. But if it's not possible for them to work from home, we carry out our risk assessment. We try to bring them back into the workplace. And the management regs, the 2000 management regs require us to carry out risk assessments anyway that cover all aspects of the workplace. And again, we should be doing that. And we mentioned at the start the need to carry out a COVID-19 risk assessment before we bring people into the workplace. And as I would discuss the various things such as looking at congestion points, communal areas, sanitizer, face coverings, social distancing. We also need to put in a regime that's going to work for us of weekly testing. And we also need to look at vaccination if that's going to have a bearing on the risk assessment. It's not reasonably practical to require that or even to include it in the risk assessment at this stage, because probably maybe only 50% of the workforce may have had their vaccination so far. Once it becomes more widely available, it may become a more readily identifiable, reasonably practical control for to put into the risk assessment. However, all we need to do at this moment in time is to encourage employees who have returned to the workplace to get the vaccine. We can't do anything more than that. We can just encourage it all at all opportunities. And we can have discussions with them if they're in any way sort of not quite sure why, or if they've got some sort of how would you put it, anti-vaxxer ideas that they picked up on the internet. Have a chat with them, discuss those with them, provide them with information, and hopefully that will maybe move them to getting the vaccination. As I say, briefings as the vaccine becomes available, we should do that. We should also say, if you've had the vaccine yourself, tell them about how you reacted to it. Was there any issues? If it wasn't sore, if there was no side effects, or if there were side effects, let them know. Have a discussion. And I think if they see more people having the vaccine in the workplace, they're more likely to get it themselves. Anyhow, in the advance of the vaccinations becoming more widely available, we need to consider and continue with weekly testing, and also making sure that staff or employees are using the Stop COVID NI app just on their mobile phones and devices. So, right, so get vaccinated is the message. Following the latest advice that I think people under 40 should be receiving the Pfizer. The vaccines are now being made available from various organisations in Northern Ireland. GPs may be approaching some of their patients. Certain pharmacies are delivering the vaccination, and there's also the main vaccination centres dotted through. I think there's one in each county that employees can go to as well. So there is lots of opportunity to get the vaccine. As there may be less choice at certain centres depending on the types of vaccines. I think the pharmacies are more restricted to AstraZeneca because it's of the ease of which they can store it. The larger vaccination centres such as the Royal and the SSE and some of the leisure centres, they will be supplying likes of Pfizer. After vaccination, we need 2 doses, and it's important that we encourage people to carry on and get their second dose. Ultimately, no vaccine will give 100% protection. That's why they're still doing the lateral flow tests with people in the workplace, just to see, because obviously it may reduce the health effects and produce asymptomatic carriers, and that's why we need to make sure we get people beyond that stage to the second dose. You must continue, or people who have been vaccinated with the first dose must continue with the social distancing requirements, wear face coverings, and wash their hands, obviously, going forward as well until they get past the second dose, and the majority of the population get past that point as well. Documentation. I think throughout this we've talked about documentation, some of the key things we need to have. We need to have a COVID-19 risk assessment. We need to document what our findings are, and that's going to be different for every business. It's going to be dictated by what you actually do, the type of premises you have, the activities that take place in that building, and needs to be kept under regular review. As I say, guidance, legislation's continually changing and being amended. We've also got to make sure we get safe systems of work in place. We've got to look at our policies, procedures, and start to thread this through pretty much through everything that we do. We've got to keep records, and an example might be, as I say, if you're providing lateral flow testing, obviously the records kept by the testing companies, but you also need to maybe try and keep records or internal records in your HR system of people who have been vaccinated, so that again we can also sort of monitor the uptake and encourage people to get vaccinated. So essentially, again, I mentioned earlier, we've got responsibilities to visitors, employees, contractors, volunteers. If there's work experience people coming in, we've got responsibilities there under the Health and Safety at Work Order. And we've got to, as I say, treat them all pretty much, well, the same. Other things that we may need to consider would be maybe putting an employment assistance program in place to provide maybe impartial advice and guidance and help to employees. And maybe usually a good EAP system will provide advice and everything from financial to maybe worries about maybe vaccination, health, etc., maybe childcare. So those facilities are those systems are worth putting in place, and we have a system which can do that. So yeah, I think that's really a very quick well, 45-minute potted guide to returning to work after COVID. If there's any questions, I think if you want to maybe put them to Dermot, and we'll see if we can find some answers.
Yeah, Paul, thanks so much for that. And
Paul,
Dermot there. Yeah, there was just one question came up there, Dermot. I don't know if you saw it in the chat box there. It was from Judy, and I think you may have touched on, Paul. It was, what if a member of staff doesn't want to get the vaccine? Can they return to the workplace?
They can return to the workplace, but you need to risk assess what they're doing, where they're located. You may have to look at the role they have, because again, if they're maybe client facing or possibly working in a healthcare environment, we need to make sure that we're not maybe possibly exposing them to other maybe more vulnerable people. We may need to, as I say, reassess that. We would also need to maybe, well, look at ensuring that we roll out some sort of lateral flow testing as well in the workplace to try and minimize any risk. But again, we should always be encouraging people, unless there's to try and get the vaccination at this stage if we possibly can.
I suppose the other thing then, just to bear in mind from that point of view, is the employment law implications then, that you're not discriminating against someone because of their decision not to take the vaccine. So you have to be careful from that point of view. And unfortunately, there's no black and white answer, because there's no precedent set, there's no case law. This is all new. So unfortunately, that's where you're at. You just have to, I suppose, weigh up your responsibility from a health and safety point of view, and then risk assess it and just make your decision based on that. But you have to bear in mind the employment law implications as well, because of the, you can't be discriminating to anybody as well. So that's it.
Yeah, I noticed, Paul, from your presentation, that was very much all staff, all employees need to get temperature tested, and everybody, there's no kind of segregation. But at the same time, you said it would be good to have a list of who's vaccinated and not vaccinated on your HR database.
Yeah, it's going to be, yeah. Some businesses are asking for that. They're keeping that confidential information. It's good to monitor it because it will have an effect overall in your risk assessment. If you have a larger percentage of people who are vaccinated, it reduces the risk for the non-vaccinated staff, maybe the more vulnerable staff. And if you're providing services to maybe care-related services, again, it reduces the overall risk as well. So it's worth monitoring. It's like anything else, that information is obviously it's confidential. The employees may not wish to share it, but some may. So really, I think encourage, get the conversation going. I don't think we can do much more than that, other than encourage and nudge people to try and get the vaccination where at all possible. We can't, it's not compulsory.
Okay.
There's a question here from Seamus O'Kane. Just we mentioned e-learning to facilitate staff training being available from Peninsula. How can we access that? I suppose I can take that. If anybody wants to find out more about that, the type of services we can provide, there's training there. So we have training on, there's COVID reinduction to the workplace for both managers and then all employees. There's also training on working from home and setting up risk assessments. All these courses take about 20 minutes. And then the employees, we get a certificate at the end of it. So if anybody wants to find out more about that, my details should be there, and either Anna or the Chamber or ourselves will get in touch just for some feedback. And if anybody wants to find out more about that, I can have a chat with you afterwards. And so that's it. That answers that question, I suppose.
Yeah. Just looking at some other questions that have come in as well there. Yeah, I think you may have touched on it again. How do I get the government supplied lateral flow tests?
Right. If you're over 10 employees, you need to go to the HSC's website, and there's a form that you have to complete. They have quite a detailed protocol for that, because obviously they want the information to go back to their testing provider, so that it goes onto a database, and the macro data then is used. So that's how you would do that. If you're less than 10 employees and you work from home, then it's a case of contacting them. But also, I think you can go to the local test centres, regional test centres, and if it's just one-offs, they will do PCR or lateral flow with you there. If it's more than that, they can also then send out, or they can arrange to send out lateral flows to your home address. So it's not just quite that simple. So as I say, there's a process. Best thing to do is go to the HSC's website and have a look at the detail. It's probably easier for larger businesses to register online and set the system up.
Okay, there was another one there, Dermot. I'm just seeing it there. I am reopening my hotel. Is there anything I need to consider?
Yeah, lots in fact, because we've been working with a few hotels over the last few weeks, and some of them have been closed probably maybe since September last year. And obviously there's lots of risk assessments that may need reviewing. There's lots of systems that we need to make sure that they've been maintained right throughout. Things like lifts, fire alarm systems. One of the big things that we need to maybe discuss, or what we are discussing with our clients, is looking at Legionella and making sure that the Legionella risk assessments have been fully implemented, because some of the water systems maybe haven't been flushed through properly in a considerable period of time. And again, if the business has a Legionella outbreak, that's going to be way worse than a COVID outbreak. It definitely is life-threatening. So that's something that would need to be considered. And again, the usual stuff. Equipment hasn't been used for a long time. There's a huge risk from maybe extraction systems in kitchens that have probably dried out, and the sort of semi-oxidized fat is more likely to catch fire in the ducting. So there's wee things like that you need to consider, just looking at the premises and making sure they've been maintained properly. Obviously, food safety needs to be reviewed, especially if a lot of new staff are coming in. Training needs to be provided there. EHOs are still carrying out food hygiene inspections in most local authorities. They never stopped. The PSNI are out there carrying out COVID inspections as well. They were focusing over the last few weeks on licensed premises. They were taking the licenses out with them because they were double checking that the licensed premises weren't exceeding the red lines. So there's lots of things in force still. Fire authorities will be looking at sleeping accommodation, and there's a new PAS 79 fire risk assessment standard out as well that they'll be implementing and wanting to see implemented. So again, all of the enforcing authorities are out there, they're back in business, and we need to make sure that documents, risk assessment paperwork's up to date.
Okay.
Well, I have a follow-up question, Paul.
Yeah, go ahead there, yeah.
The lateral flow testing. If I have more than 10 employees, but half are working from home, do they need to complete lateral flow testing?
The people working from home, not really, no, not unless they're maybe going out occasionally and visiting clients. So I wouldn't really get too excited about them at this stage. If they're starting to go out and do visits or travel at all, then yeah, possibly. But no, if they're working from home, it's less of a risk.
No problem.
Another one I have is here. What do I do if someone does not wish to share their details or provides incorrect information?
If they don't, you can only ask. You can put the facility in place, and as long as you can show that you're recording the majority of people coming onto your premises and you're doing that correctly and you're managing it under GDPR, that's fine. If certain individuals want to come in and rename themselves as Mickey Mouse, then that's entirely up to them. They're breaking the law, and you can't do an awful lot with that. But as I say, if that's what they want to do, they're breaking the law. So say again, there could be a visit from environmental health whilst they're there, or the police, and that could result in fixed penalty fines, etc. So I think really it's do the best you can with what you have, and that'll be your defence. That's your mitigation.
I think I picked up on something there, Paul, as well. You were saying when you were telling people working from home and hybrid working, you nearly have to assume that the person working from home is actually in the office from a health and safety perspective, like that all the things you would check in an office environment, you need to think, yeah, at home, they need to be protected in the same kind of way because you have a responsibility for them at home.
Absolutely.
That kind of approach to it.
Yeah. Absolutely, and I say that hopefully by this stage, there might still be some people who are working at the kitchen table on the edge of the sofa, things like that. But yeah, really, we do need to provide facilities or encourage them to provide their own facilities that are pretty much consist of a desk and suitable chair and enough space and somewhere that's reasonably secure as well. Otherwise, we're not going to get the best. It's not going to be safe. It's not going to be suitably ergonomically safe for them, and we're not probably going to get the best out of them. So that's why, as I say, we need to reassess workplaces and the workstations, and make sure that equipment that we provide is suitable. They're not just sitting there with a little screen on their laptop. They've got suitable, maybe separate monitors, the mouse, keyboard, etc. And we provide that, and obviously any PAT testing that maybe needs to be carried out on that equipment is done as well. So yeah, we've got to pretty much treat them as if they were working in the office. It's no longer temporary, is it? We're now over a year into the situation.
Yeah, I think that's something that we've seen come up quite a lot over the past 15 months. And you know, it may not involve spending a fortune, you know, and buying fancy desks, but it may be a matter of, just from a business point of view, making sure that you've provided the correct training. And it might be a case of sticking a couple of books underneath a laptop, you know, and you know, but it's from a business point of view, it's been able to demonstrate that you've provided the necessary training in order to set the workstation up correctly, and then backing that up with a risk assessment, and then you're in a much stronger position then.
So it's really about process and paperwork and making sure you have yourself covered and doing the right thing for the employee, of course. I mean, that's
absolutely
what it's about, really.
Yeah.
So Paul, you were saying there, it's like a 3-week cycle here. You get 3 weeks. It was interesting, you said the 20th of May, you're going to have the information that we need, and the 24th we have to open. So it's, you know, we as a chamber, we have been calling for more a run-in period. Of course, in general, it hasn't happened, to be honest with you. So we weren't overly surprised when they said, look, we'll make the indicative date a bit more indicative until the 20th, and then we'll actually make it hard. But look, that's where we're at. So it's really important that people do take a good hard look on the 20th and say, okay, if anything's changed, to kind of keep it. But it must be
I also think sometimes it's worthwhile just reading behind the headlines, because we do get the headlines on the TV news, and really what actually filters into the guidance and the law can be slightly different. So it's usually better to wait till the Friday morning and then read it carefully in the cold light of day to make sure that what they've actually said applies to your industry and your business. I know we have to do that, so that's what I would do. Just wait till you see the final text.
So people are happy enough to contact you, Paul, on Friday morning.
I'll try and be there.
You're going to have a lot of questions.
Well, we have an advice team that feels that, as I say, they will be busy on Friday. That they're incredibly busy at the moment, but that's what we do.
But look, it's positive, the 24th coming. We can't wait to get some of the normality back again, which would be brilliant. Dermot, was there anything else in terms of questions you'd like to?
No, that's actually all from my end. Yeah, that's all I have. So yeah.
We'll just see whether there are any other questions here. I think we've covered off the questions that came in. Paul, was there anything else you'd like to add?
I think that's really it. Yeah, we've covered most aspects of what's coming up. I think the key thing is wait and see what we get on Thursday, Friday, and go from there.
Yeah, there was just one other thing I just wanted to add there, that the Council's COVID Reassurance Mark scheme has just been launched, and it's designed to support local economic recovery and revitalisation, while at the same time respecting the public health controls. And this initiative is geared towards boosting customer confidence to return to our town centres and villages, in the knowledge that businesses are taking positive steps to keep their customers and staff safe. And it's interesting because, you know, people will gradually build confidence to come back, and I think this reassurance mark will help that. And in order for a business to gain the mark for display on their premises, you will need to complete a self-declaration process online. And we can share that link after the webinar this morning, along with the presentation and the recording. But subject to approval, you can expect to hear the outcome of your application within 7 days. So I think that's just another way of encouraging people back into our town centres and our cities to try and build some confidence that people are taking the necessary steps within their own businesses to protect their customers and their staff. And that was just something we wanted to put in there, seeing as I've been talking about the workplace a lot. Also, that's very important as well, to try and encourage people back in to shop local, of course. So, Paul, anything else you'd like to add there before we wrap up?
Well, I'd like to thank everybody for listening to me for the last 45 minutes. And as I say, if you have any questions, come back to Dermot or myself, and we'll try and field any queries that you might have.
Yeah. I suppose just thanks, Paul, and thanks again, Anna and Paul. I suppose just from my end, if anybody does have anything that they want to discuss in any more detail, we're happy to set up a one-on-one Zoom call with myself and Paul or some of the other health and safety consultants. And if there's anything specific that you want to go over about a certain scenario, we're happy to provide some advice on it. And we can give you a look at some of the training that we have on the e-learning from a health and safety point of view as well that we provide. So we'll be happy to speak to you if you're interested in that also.
Well, just to wrap up then, Dermot, thank you so much for the kind words, and thank you to yourself and Paul as well for supporting the Chamber and giving this very, very vital information to our members. I really appreciate that. It will be going out as a video. The presentation will be sent as well. And as Dermot said, look, please reach out to us or to Dermot or Paul there if you have any specific queries that you have. It is challenging to get the information, but these guys are the experts and they can really help you to direct you in the right direction. So without further ado, I think we're just bang on time. So thanks so much again, and have a great afternoon.
Thanks. Thank you.
Thank you.
Bye now. Bye.